The heavy reliance on AI for health information among certain populations is fundamentally a symptom of systemic failures in the U.S. healthcare system. When people turn to AI not as a convenient supplement to quality medical care, but as a substitute necessitated by inability to access or afford actual care, we're looking at technology papering over inequality rather than addressing it. This is a critical distinction that policy discussions often miss. Discussions about AI in healthcare frequently treat it as innovation and progress, celebrating how technology democratizes access to health information. But we need to ask why democratizing access to information is necessary. The need for free AI health guidance exists because actual medical care is prohibitively expensive or inaccessible for many Americans. Consider the patterns of heavy AI use. It's disproportionately people without insurance, people with high deductible plans they can't afford to use, people in areas with provider shortages, people who can't take time off work for appointments, people who can't afford transportation to medical facilities. These are the populations experiencing healthcare access failures. Their AI use is adaptation to a broken system, not free choice among equal alternatives. When we celebrate AI making health information accessible, we're celebrating a Band-Aid on a gaping wound. The wound is systemic underinvestment in healthcare access, especially for low-income communities and communities of color. This normalization of second-best solutions is ethically troubling. As AI becomes more sophisticated and widely used, there's risk of politically treating it as solving access problems rather than as highlighting them. Policymakers might point to AI availability and claim that healthcare access has improved, when in fact the fundamental problems of cost and availability remain unaddressed. This allows continued underinvestment in community health centers, Medicaid expansion, insurance coverage improvements, and provider recruitment for underserved areas. The presence of AI becomes an excuse for not addressing root causes of health inequity. The disparate quality of alternatives is stark. Affluent Americans with good insurance see doctors for minor concerns, have easy access to specialists, get thorough workups for concerning symptoms, and use AI as a convenient supplementary resource for additional information. Poor Americans use AI instead of seeing doctors because they can't afford appointments, delay care hoping symptoms resolve, and only seek in-person care when situations become acute and expensive. This two-tier reality where some people have both AI and professional care while others have only AI is not progress toward health equity. AI's role should be reconceived from solution to diagnostic tool, not a diagnostic tool for individual health problems, but for systemic healthcare access problems. AI usage data can highlight where access is most limited. Communities with heavy AI use for basic health questions likely have inadequate primary care access. Patterns of AI queries about affording medications or navigating insurance problems reveal systemic issues. This data could inform public health policy and resource allocation. Instead of celebrating high AI use as successful technology adoption, we should read it as a distress signal indicating healthcare access failures. Policy responses should channel investments toward actual care rather than accepting AI as a substitute. The goal should be ensuring everyone has access to affordable, timely medical care. This requires addressing systemic issues, expanding insurance coverage, reducing costs, increasing primary care capacity, addressing provider shortages in underserved areas, improving transportation access to medical facilities. AI can play a supporting role in this expanded system, but it cannot be the primary mechanism of healthcare access for disadvantaged populations. There's also the issue of dignity and equity. Healthcare is not just about information, it's about human care, physical examination, diagnostic testing, and therapeutic relationships. Using AI for health guidance because you can't afford a doctor is qualitatively different from using it as a supplement to regular medical care. The first situation represents exclusion from full healthcare access. The second represents convenience. We should not normalize a system where some people get human medical care and others get AI as if these are equivalent offerings. The uncomfortable truth is that AI health tools are succeeding in part because the U.S. healthcare system is failing. Their popularity is a market response to unmet need created by systemic inadequacy. If we had universal access to affordable, timely, high-quality medical care, AI health tools would still exist, but would occupy a very different niche. Optional convenience and supplementary information rather than necessary substitute for inaccessible care. Working toward that future requires policy changes that address healthcare access directly rather than celebrating technology as if it solves problems it merely works around.